So today we're going to talk about the differences between HA dermal fillers and PDO thread lift. When we talk about HA fillers, those are really meant to add volume back to the face. So when we age, we have natural volume loss, and the main areas where we can treat with filler are, or common areas, are temples, under eyes, mid-face, lateral cheek, chin, jawline, and of course the lips, among some other areas too, but those are kind of the main ones. It's really great for, like I said, replacing the volume and also getting more contour, helping light reflection, and just balancing out the face so everything flows naturally together. On the other hand, PDO threads are kind of more meant to lift the tissue. So when we put them in underneath the skin, and they are made of a dissolvable suture, and they have little barbs or hooks on them. So when placed under the skin, they are actually able to grab onto the tissue and lift. So we're actually able to move the tissue without adding volume to the face. Usually the treatments go best when combined. So we would do threads, see you back in a couple weeks, and then those areas that are needed or needing extra volume, we can still add that filler. So it's not necessarily one or the other, but if you do have a lot of lifting that you're wanting to get, that's best done with threads. And if you're just looking to contour or add more balance to your face, that would probably be better to do with fillers. So really good to look at you first, do a full consultation, see your goals, and kind of like what you're wanting to do long term as far as other procedures. As I said, the threads are made of a dissolvable suture. Those threads start to soften and dissolve over the first 6 months, but they do stimulate collagen production in your body. So you do get a long-term result from them, up to a year and a half usually, because of the collagen. Recovery for the threads, I always tell people, give yourself a full 2 weeks, no strenuous exercise, no heavy pounding exercises, no sleeping on the face, and then just no like really overdone expressions like big smiles or opening our mouth really wide, because the tissue is actually pulled pretty tight, and we want the skin to be able to really adhere to them. With the fillers, on the other hand, they range in their duration or longevity from anywhere from 6 months to over 2 years. And we're learning more and more all the time about how much longer fillers are lasting than we originally had thought. Also with the threads, you don't have to worry about like any migration. You don't have to worry about looking overfilled, because like I said, that those threads do dissolve over time. The areas that we can treat with threads, well, you can treat with smooth threads, collagen threads, really anywhere over the body. But with the barbed lifting threads, they are great for lifting the eyebrows up, mid-face, which really addresses this nasolabial fold that is bothering a lot of people. And then we can also do jawline, which really helps with that jowling that some people are complaining about. And then they're also great for lifting the neck up. Like I said, actually being able to lift without adding volume. So anybody who already has like a fuller face and it's not wanting to add more volume to their face, it's a really great option. It's meant to be a bridge over if you're not ready to get a surgical facelift. This is about as close as you can get as far as repositioning the tissue without surgery. For the threads, we do local numbing all over the treatment area. It might be a little bit more just discomfort than you would have with the just filler alone, but we do keep it as comfortable as possible, and have a lot of different methods we can use to keep you comfortable throughout the procedure. And then really just kind of tender and tight feeling for the probably the remainder of that week. So not too bad, but it's really different for everybody. With a filler, we use topical numbing. Usually people do really well with it. Once you come in, we'll do a full consultation that day, and then the actual treatment, depending on which areas of the face we treat. If you just treat one area, you'll be out within the hour. If we did full face, full neck, probably schedule in 2 hours so that you can have breaks and that we can keep you really comfortable. I'm Brittany Anderson. I'm one of the nurse practitioners here at NTPS Med Spa. I work at the Dallas and the Plano location. If you would like to learn more about PDO threads or fillers, send us a DM or see the links below.